সুপ্রিয় দর্শক, আপনাদের সবাইকে আমন্ত্রণ জানাচ্ছি কোকিলাবেন ধীরুভাই আম্বানি হসপিটাল অ্যান্ড মেডিকেল রিসার্চ ইনস্টিটিউট নিবেদিত স্বাস্থ্য বার্তা অনুষ্ঠানে। আপনাদের সাথে আছি আমি ডাক্তার ফাতিহা শাফি, আর থাকছি অনুষ্ঠানের পুরোটা সময় জুড়ে। দর্শক, আজ আমরা অত্যন্ত গুরুত্বপূর্ণ একটি বিষয় নিয়ে কথা বলতে যাচ্ছি। আজ আমাদের অনুষ্ঠানের বিষয়বস্তু চূড়ান্ত করা হয়েছে নারীদের ক্যান্সার নিয়ে, আর এই বিষয় নিয়ে কথা বলার জন্য আমাদের সাথে উপস্থিত আছেন ভারত থেকে আগত বিশেষজ্ঞ চিকিৎসক। আমাদের সাথে আছেন ডক্টর যোগেশ কুলকার্নি, যিনি গাইনি অঙ্কোলজি এবং রোবোটিক সার্জন হিসেবে খ্যাত। 20 বছরেরও অধিক সময় গাইনি অঙ্কোলজিতে তিনি দক্ষতার সাথে কাজ করে আসছেন টাটা মেমোরিয়াল হসপিটাল এবং কোকিলাবেন মেমোরিয়াল হসপিটালের সাথে। তিনি মুম্বাইয়ের প্রসিদ্ধ গ্র্যান্ড মেডিকেল কলেজের লেকচারার হিসেবে কর্মরত ছিলেন। ডক্টর কুলকার্নি 3000-এরও অধিক গাইনি অঙ্কোলজি সার্জারিতে সফলতার ছাপ রেখেছেন। এবং আমাদের সাথে আরও থাকছেন ডক্টর বিদিশা, যিনি মুম্বাইয়ের টাটা মেমোরিয়াল হসপিটাল, মুম্বাই পোর্ট ট্রাস্ট হসপিটাল এবং এশিয়ান ক্যান্সার ইনস্টিটিউট মুম্বাই হসপিটালের একজন নিবেদিত ব্রেস্ট অঙ্কোলজি সার্জন হিসেবে প্রসিদ্ধ, যিনি মানুষকে প্রচলিত ভুল ধারণা থেকে সরিয়ে মহিলাদের ব্রেস্ট ক্যান্সারের সচেতনতা সৃষ্টি করেছেন, লক্ষণ সম্পর্কে অবগত করেছেন। ডাক্তার বিদিশা 15 বছরেরও বেশি সময় ধরে 400-রও অধিক সার্জারি সফলতার সাথে সম্পন্ন করেছেন। এবং আমাদের সাথে আরও থাকছেন মিস্টার দীপক চাওলা, যিনি সবারই পরিচিত। তার আসলে কাজটি হচ্ছে অন্য দেশ থেকে স্পেশালি ইন্টারন্যাশনাল পেশেন্ট, বাংলাদেশ থেকে আগত রোগীদের তিনি সাহায্য করে থাকেন ইন্ডিয়ার স্বনামধন্য ডাক্তারদের সাথে যোগাযোগ স্থাপনের ক্ষেত্রে। Welcome to all in our show. It's our immense pleasure to have you all in our show.
Thank you.
Dr. Yogesh sir, have you ever been to Bangladesh, or is it the first time?
This is first time I have been to Bangladesh. I think it was planned a couple of times before, but it somehow didn't work out. So this is first time, and I am really enjoying my time in Bangladesh right now.
Okay, so can you please share your experience with us?
Oh, I think the feature that I found most staggering was the friendliness shown by people around. I think all of them were very friendly, even though I do not understand Bangla. I did not struggle at all, in terms of communicating, and they communicating back to us and trying to help us out at every possible step.
Okay, so sir, gynae oncology, that's a very well-known topic in our medical sector. So what is, how can we define gynae oncology for our regular viewers?
Yeah, so gynae oncology is now a subspecialty which is carved out of gynecology, and it deals with cancers that are developed in women in gynecological systems. So essentially it's a specialty that deals with cancer of uterus, cancer of ovary, cancer of cervix, cancer of vulva, vagina, and fallopian tube. So anything that develops, a cancer that develops in the reproductive system comes under the purview of gynae oncology.
We consider cancer as a life-threatening disease. So what is the common cancer in female patients?
Yeah, so I think worldwide for a long time cervical cancer was the #1 cancer in women in India. And while I was coming, I also had a look at the statistics in Bangladesh. Okay, and even in Bangladesh now breast cancer is the #1 cancer for women in Bangladesh, and cervical cancer is #2. Same is the story in sort of Asia. But when you look at overall world, breast cancer now is the #1 cancer, followed by the gynecological cancers like cervix, ovary, uterus, and the rest of the cancers.
And now I'm coming to Dr. Vidi. So you are a breast cancer surgeon. Okay, so what is this is the most common cancer in female breast cancer. How can we define breast cancer?
So breast cancer is currently the most common cancer seen all over the world in females.
Okay.
In India, and I'm sure in Bangladesh also, it is the highest number of cancers that is seen. And breast cancer usually presents as a painless breast lump.
Okay.
So it is very necessary that the female will feel the lump themselves. And sometimes it is also associated with some nipple changes, some bleeding from the nipple or swelling of the underarms. So these are the things that the female should notice and bring it to the doctor when they see this kind of lumps.
Okay. Well, is there any symptoms like patient can feel?
So these are the symptoms that they have to feel for the breast lump.
Okay.
So they sometimes notice the breast lump, but because it is not painful, they do not report to the doctor. So it is very important for them to know that painless breast lumps can be breast cancer, and otherwise also any subtle changes in nipple, any bleeding from the nipple, any changes in the nipple shape can also be symptoms of breast cancer, and they should come to the doctor immediately.
Okay. What is the risk factor basically in cancer?
So I think I will talk about gynecological cancers, and I think we all know that cervical cancer, there is a specific virus called human papilloma virus, and the infection with HPV virus is associated with increased risk of cervical cancer, vulval cancer and vaginal cancer. And there are certain cancers which are increasing because of lifestyle, say like ovarian cancer or endometrial cancer, because of less pregnancies, no breastfeeding, all the other things, or say fast food, poor dietic habits are leading to increased risk of certain cancers like ovarian or endometrial cancers.
Okay. Does age plays any role in that sector?
Yes, I think initially we always thought that cancer is the disease of old age. Most of the cancers we would see were beyond 50 or 60 years of age, but that's no longer the case. Nowadays, a significant portion of patients that we see in our outpatients are less than 40 years of age. So age is not a protective factor against cancer. I think what is more important is being aware of it, being aware of the risk factors, and being accessible or access the doctor whenever you have any doubt about anything. So I think young age should not be considered as a protection against cancers.
So how can you investigate the breast cancer?
Yeah, so whenever a patient comes with a breast lump or any breast symptoms that I mentioned, we usually clinically examine the patient, and also we try to image the breast. If the patient is young, we advise sonography of the breast or MRI of the breast, and if patient is more than 40 years of age, the first investigation we advise is a digital mammography. Okay. Along with that, if there is suspicious lump, the biopsy is must. Okay. Because biopsy will give us a confirmatory diagnosis and also tell us about the type of tumor that we are looking into, because now the tumor type decides the type of treatment that will be offered to the patient. So this is very important, that imaging of the breast with mammography and biopsy of the tumor.
Okay, we all know about the self-breast exam, that is well known to our viewers. So how does it work actually?
So when we advise self-breast examination to everyone above the age of 35. Okay. So the whole idea is that you have to be more familiar with your own breast. Every breast is different in feel. So if you are aware about your normal breast, only then you will be able to pick up any subtle changes, and then you will be able to come to the doctor quickly, because when you detect early, breast cancer is curable. Okay. So we advise all the women above the age of 35 to regularly do self-breast examination.
Okay, 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 sir. So now I'm coming to you. How we can investigate the gynae cancer actually?
Yeah, I think investigations. I think I'll first highlight a little bit about prevention. Okay, I think cervical cancer is the most common gynecological cancer, and there is a very effective test, called pap smear, which is used to diagnose or precancerous changes that develop in the cervix. And normally, from precancerous changes to development of cancer, it almost takes about 10 to 15 years. So it gives you a long window to act on. So I think all women, beyond 30 years, at least one pap smear, and pap smear once every 3 years is something that I would strongly recommend.
So now I'm coming to you, Mr. Deepak. Do we have other doctors that are involved in breast cancer or gynae cancer patients?
At Kokilaben Hospital, we have a big team. An entire team works together. Like Dr. Yogesh mentioned, it all begins with the diagnosis. So we have specialists, imaging specialists, pathologists who diagnose. Then we have a team of surgeons, 2 of them sitting with you. And we have radiation oncologists and medical oncologists. We all work. In cases of surgeries like mastectomy, we also take the help of reconstructive plastic surgery.
If our patients from Bangladesh wants to go India, so how will they do it?
So both the doctors and all our doctors have treated patients from over 100 countries so far. So we are very reachable. In Bangladesh particularly, we have our own information center which is in Banani, and we will be sharing the contact details and address of that. And with it, we take advantage of technology. These days, almost every day we have video consultation where the patient oftentimes does not even have to travel.
Okay, so you also provide telemedicine
and video consult.
Okay.
So even for your first consult, you don't have to hold yourself back. You can take opinion from the best of the doctors.
Oh, cool. Yeah. That's a great idea. Sir, I just want to know from you about the treatment procedures of gynae cancers.
I think, you know, for any cancer treatment, there are three major modalities of treatment: surgery, chemotherapy, and radiation therapy. And depending on the type of cancer, the stage of cancer, patient's fitness, you decide what treatment suits best for the patient. Okay. So say for ovarian cancer, let us say surgery is the primary treatment followed by chemotherapy. For cervical cancer, surgery and radiation form a combination that can be used, or patient can be treated either with surgery or with radiation. For endometrial cancer or the uterine cancer, surgery is the treatment of choice. So it depends, the treatment will depend on the type of cancer, the organ of origin, and the stage of cancer.
In the beginning of the show, that cancer is considered as a life-threatening disease. So what's your opinion in that case?
Oh, it's not at all. As long as you diagnose cancers early, they can be perfectly treated. They can lead a normal life, you know, without any worries. Okay, so it all boils down to diagnose it early.
Dr. Vidya, how we can prevent breast cancer? That's a very common cancer in female, as I have mentioned before. So how can we prevent that?
So more than prevention, it is the early detection that is important. So it is necessary to be aware. If you have a family history of breast cancer, then it is very necessary that you undergo regular breast examination by a doctor starting early. Also, it is very important that you do self-breast examination of your own breast, so that you can pick up. And if you have any symptoms that we mentioned, please reach out to the doctor at the earliest and do not delay it, because in early stages, like I said, breast cancer is curable when detected early. So that is very important.
Okay, so what is the treatment procedure in this center?
So like Dr. Kulkarni mentioned, the treatment protocols for breast cancer are similar. We have surgery, we have chemotherapy, radiation therapy. Depending on the type of tumor and the stage of disease, we decide the best treatment of what it can be offered to the patient. If the tumor is bigger or if little advanced disease, then we first offer a chemotherapy followed by surgery. Or if the tumor is very early, small tumor is there, then we do surgery first.
Dr. Yogesh sir, what do you think that when the women should visit to you?
Yeah, so I think you know, the most common symptom for gynecological cancers is abnormal bleeding. So any women who has abnormal bleeding or bleeding, postcoital bleeding as we call, or there is distension of abdomen, loss of appetite, you know, severe pain in the abdomen, indigestion, you know, prolonged indigestion, constipation. These are the warning symptoms. Now, if a woman has this symptom, it does not mean that she has a cancer. What it means that these are the symptoms where she should go to a doctor and rule out cancer. So that's what she needs to do.
Okay, I'm coming back to you later. Now I'm going to Mr. Deepak. Tell us about your hospital, if you like, how you provide treatment to the international patients.
Our hospital is a platform that allows us to do the kind of work we are doing, the good work we are doing. It is located in Mumbai, started around 15 years ago. Patients are coming from all over India, all over world for treatment, and our goal is to have a world-class institutional hospital in India where healthcare is accessible to all.
Okay, so if as Bengali is our native language, so there are so many people they do not know about English or Hindi. So how they would go to you?
So we have a dedicated department to help with Bengali patients with the Bangla coordinator.
Okay.
And around 4 to 5 of our surgeons speak excellent Bengali.
What kind of complications may arise after that surgery, as you have mentioned before?
There can be multiple complications that can happen, but what I look at is what is the risk of complications after surgery. And even after a complex cancer surgery, the risk of complication is about 1 to 3%. Okay, but the complications can be variety. You know, sometimes there can be infection, sometimes there can be bleeding. They can have what we call as deep vein thrombosis or wound infections or pneumonias. The risk is 1 to 3%. So when you look at it, 97% of the patients will not have any problem, and those 1 to 3% who unfortunately, if they do get a problem, we need to treat it accordingly.
Okay. Now, Dr. Vidi, can you please let us know elaborately what is the risk factors of breast cancer?
Breast cancer surgeries are very safe compared to any other surgeries, breast cancer surgery, because it's more of a surface surgery, or we are not getting inside the body. So breast cancer surgeries are very safe. As with any surgery, the risk of bleeding or infection which is there, which is as common as any other surgery, is there. With breast cancer surgeries, patient can be mobile after 4 hours of surgery. By evening of the surgery, they are eating, they are sitting up in the bed, and very next day we tell them to do all the activities. In fact, we can discharge the patient also the very next day, and they do not require any more help. They are very much on their own, very comfortable, and we tell them to be as active as possible so that their recovery is faster.
Okay, thank you so much. Now, Dr. Yogesh sir, there is a common complaint, like if a patient receive chemotherapy, he or she feels like vomiting and his hair may lose. So what do you want to tell about that?
Yeah, so I think this is something, you know, obviously hair loss is what I won't call it a side effect. It's an outcome of chemotherapy. Okay. But the thing that the patient needs to understand is that the hair loss is not permanent. Okay, once the chemotherapy is stopped, the hairs grow back again, and they don't have to worry about it. That is one. Now there are certain problems that can happen with chemotherapy, is like vomiting, you know, sometimes they feel weakness, you know, they feel nausea, they don't feel like eating, and that happens for first 2 to 3 days after chemotherapy. And nowadays there are very effective drugs that work against these symptoms, like for vomiting and nausea. There are very strong drugs which reduces the you know, sort of intensity of this symptom. It doesn't mean that it brings down to zero, but the advantage with chemotherapy are all the side effects are there till the chemotherapy is on. Once you stop the chemotherapy, the patient gets back to their normal life. That's the key, you know, with chemotherapy. So what they have to tell themselves is they have to look at the bigger picture. What is there after chemotherapy is more important than the small trouble that they have to you know, endure during taking chemotherapy.
Okay, you were mentioning about the online consultation. Can you please brief us about that in details?
Online consultation is done where a patient can talk to the doctor face to face. The process is simple. This is app that we share with you, on which you register. It's a simple process, and upload your latest report. Please ensure you highlight your reports, upload your latest report. After that, you are given a time schedule. On that time, you use your mobile phone, you can use your laptop, you can use your tablet, whatever you like, with the camera, and you are there with the doctor face to face. And you get a prescription also after the consult.
So now I would love to hear from you that what are the newer technology that has invented in gynae's cancer surgery?
So I think, you know, the latest and the most exciting development that we have is the use of robotic surgical platform for performing cancer surgeries. Now I am very proud to say that our hospital was the you know, one of the earliest to acquire the robotic system as early as in 2012. And currently we have 2 robotic systems which are installed at Kokilaben Hospital. Now the advantage of robotic surgery, one, it's a keyhole surgery. 2 is the vision that you get is a 3-dimensional vision. 3 is the magnification that you get is almost 10 times. And last and the most important point is the movement of the instrument is just like human wrist. So you have very good control while you are operating, while you are dissecting close to major blood vessels. So any complex surgery, becomes extremely easy by using the robotic surgical platform. And worldwide now, it has becoming a standard, to use robotic platform to perform complex cancer surgeries. We have performed at Kokilaben we have almost all specialties are using robotic surgical platform, and we have done more than 4,000 cases of robotic surgery at Kokilaben. And I think patients are extremely happy, because a patient comes, on the day of surgery, gets operated, they get discharged in a couple of days time, and they can get back to their work in a week's time. So that's the distinct advantage of robotic surgery. The second development that is happening is in the field of immunotherapy and precision oncology. So initially we were all treating the patient based on what the biopsy report suggested. Okay, but nowadays, the science has told us that apart from biopsy reports, there is something more, what we call as molecular footprint of the tumor. That decides, how a tumor is going to behave. And with the help of understanding the genetic makeup of the tumor, you can identify certain targets which can be used for giving them immunotherapy. And there are some remarkable results that we have observed with immunotherapy and precision oncology. So these are two things that are reducing. So what the other thing that precision oncology may do is, it may reduce the need of chemotherapy in certain subset of patients. So I think that is a significant advantage for patients.
Okay, thank you so much, sir. Now coming to Dr. Vidhi, can you please tell us about the advanced technique in breast cancer surgery?
So all over the world, the gold standard is mastectomy, but for every female, losing a breast is very difficult. Okay. So the newer technology that we have come with, the advances in medical science, is that there is no need to do mastectomy. We can offer breast conserving surgery to most of our patients. I wouldn't say 100%, because it depends on where the tumor is and how big the tumor is. But more than 80% of patients need not lose their breast. We have a lot of different type of oncoplastic surgeries that we do, where we can conserve the breast, so patient does not have to lose a breast. And even if they have to, undergo a mastectomy because of the disease, we do have a lot of reconstructive options where we can reconstruct the breast. We can take tissues from the body itself. So we have an excellent plastic surgery team. So we take the local tissues, we can take the back muscle, we can take the abdominal muscle and reconstruct and try to give as normal looking breast as we can. We also have options of doing implant surgeries where the volume of breast we cannot reconstruct just using the local. So what the message we want to give is that, just because you have been diagnosed with breast cancer doesn't mean it's the end of everything. There are a lot of options, lot of surgical options, treatment options that we can offer, and then we can try and give as normal looking breast as patient can have. And also like Dr. Kulkarni said, that the precision oncology, so now we have immunotherapy in breast cancer also, so that helps us to effectively treat breast cancer more aggressively. So in younger and younger patients we are offering this immunotherapy, and it is giving excellent results, and we are able to offer cure to even advanced diseases because of the immunotherapy. So this is a new thing that's come up. Obviously also there is a role of genetic testing that has been there. So we advise genetic testing if you have a strong family history of breast cancer, and we are able to pick up patients who are positive for the mutation, and in such cases we do offer them prophylactic surgeries also, so that the risk of developing breast cancer in future can be reduced. So this is also one thing that has which we offer at our hospital.
I think that's a very great news for the young patient.
Right. Yeah.
Okay. So now, Mr. Deepak, I don't know this question will be relevant or not, but I would like to hear from you that what is the actual expense? Can you please brief us?
Particularly since we have gotten so much trust and love from Bangladesh, we understand, and our prices are definitely not expensive. Okay. They are at par with any tertiary care hospital, and we are sensitive particularly to the Bangladeshi patient, where an adjustment needs to be made, we do make.
This is the end of our program. Thank you so much for being with us.
Thank you. Thank you.
দর্শক, আপনাদেরও অসংখ্য অসংখ্য ধন্যবাদ আমাদের সাথে এতক্ষণ থাকার জন্য। আমি জানি এই অনুষ্ঠানের মাধ্যমে আপনারা নারীদের ক্যান্সার সংক্রান্ত অনেক কিছু জানতে পেরেছেন, আর আপনারা জানলেই আমরা এর সার্থকতা খুঁজে পাবো। আপনাদের জন্য অনেক অনেক শুভকামনা জানিয়ে আজকের মতো এখানেই বিদায় নিচ্ছি। সে পর্যন্ত সবাই ভালো থাকবেন, সুস্থ থাকবেন এবং এটিএন বাংলার সাথেই থাকবেন।